Good afternoon, everybody. Welcome to the Health and Human Services Subcommittee on Budget and Taxation. Happy Monday. We're meeting today for the purposes of a budget hearing on the Maryland Department of Health Behavioral Health Administration. We're first going to start out with our fantastic analyst, Naomi Camaro, and then we'll hear the agency response. And we do have a number of public witnesses today. So with that, Ms. Camaro.
Thank you, Mr. Chair. My name is Naomi Camaro with the Department of Legislative Services, presenting the analysis of the Behavioral Health Administration budget. The fiscal 25 allowance includes $3.2 billion for BHA. On page 4 begins discussion of a few different performance measures that the department reports out. First is related to the utilization of the public behavioral health care system over the past few years. In fiscal 2023, nearly 318,000 people were treated by the Maryland Public Behavioral Health Care System. Exhibit 1 on page 5 shows the total number of individuals treated between fiscals 2019 and 2023 annually, broken out by diagnosis. In Exhibit 2 on page 6, shows the estimated need for behavioral health care services in the state. MDH provides estimates among adults and children. This chart shows the percentage of individuals, both children and adults, who are accessing services out of the number that MDH estimates needing or wanting care. And so that proportion has been increasing between fiscal 2021 and fiscal 2023. The second measure discussed in the analysis is the utilization of telebehavioral health services. Language in the fiscal 2024 budget bill required the department to include utilization data statewide with the submission of fiscal 2025 managing for results data. In Exhibit 3 on page 7, you can see that the utilization of these services significantly increased starting in fiscal 2020. This is due in part to the COVID-19 pandemic impacting people's ability to access in-person care, as well as a change to the eligibility of audio-only telehealth services for reimbursement. The Department of Legislative Services recommends the release of $100,000 that was restricted in the fiscal 2024 budget bill due to or pending the submission of this report, and we will process a letter to this effect if no objections are raised by the subcommittee. The final measure that we've discussed in this analysis is the use of medication for the treatment of opioid use disorder, or MOUD. The Department of Health also submitted a report during the interim due to a restriction in the fiscal 2024 budget bill on MOUD usage in substance use disorder treatment. Exhibit 4 on page 8 shows the number of people receiving substance use disorder services and the proportion of those who also received MOUD. On page 9, we include discussion of where these services are offered, and Exhibit 5 on this page shows the estimated number of people who need MOUD services and the number of treatment programs, or rather the amount of the capacity that the treatment programs in each jurisdiction offer. Because there's quite a bit of variety in the number of people in need and the number of services offered in each jurisdiction, we've asked MDH to comment on its work with the local behavioral health authorities to address insufficient supply of MOUD services in their jurisdictions. Page 10 continues the budget discussion, starting with fiscal 2023 reversions. At fiscal 2023 closeout, BHA reverted more than $100 million in general funds. That's mainly driven by a $4.5 million reversion due to program delays, which includes $35 million that was appropriated for crisis response programming, which I'll be discussing more in a couple minutes. I also wanted to point out $2.5 million that was reverted, originally intended for the Sheila E. Hickson Behavioral Health Services Matching Grant Program, which was which was established by legislation in the 2021 session. The fiscal 25 allowance includes $2.4 million for this program. This funding was originally reverted in fiscal 2023 because BHA was unable to staff the program. And so we've asked MDH to comment on if it has now adequately staffed the program as of the 2024 session. On the next page, we've listed out a couple of proposed deficiencies that are included in the fiscal 25 allowance. There are 4 proposed deficiency appropriations that increase the fiscal 24 appropriation by $438.2 million. This is mainly driven by funding included to address shortfalls in behavioral health related Medicaid services in fiscal 24 and fiscal 23. On page 12, Exhibit 6 breaks out the funding in the fiscal 25 allowance under behavioral health related just to provider reimbursements. So provider reimbursements and the provider rate increase make up about 87% of the total BHA budget. And of that amount, 85% is dedicated to Medicaid services. On page 13, this breaks out the remaining expenses covered under BHA. So this excludes provider reimbursement costs and includes the funding that's going to the core service agencies that provide services at the local level, as well as new behavioral health investments that started in fiscal 2024. Also point out there's $32 million for the ASO contract and about $17.5 million for the 988 trust fund and expenses related to the 988 service. On pages 14 and 15, Exhibit 8 shows the major changes in the Behavioral Health Administration budget in fiscal 25 compared to fiscal 24. Again, the entire budget is decreasing by about 4%. This is offset a bit by increases in personnel costs due to the addition of 69.5 new positions. There's also an increase to the 988 trust fund in order to meet the $12 million mandate established by legislation in the 2023 session. On page 15, you have a couple of the larger decreases that are driving the net decrease change, including a reduction of $18 million due to one-time expenses in fiscal 24 for the new behavioral health investments, as well as decreases in provider reimbursements that reflect a projected decrease in Medicaid enrollment and utilization in fiscal 2025. On page 16, we've discussed a couple of uses of special funds in the governor's proposed budget to offset the use of general funds under BHA. The first is related to the Senior Prescription Drug Assistance Program, which is actually under Medicaid. The Behavioral Health Administration budget includes $5 million for behavioral health services, and that funding is originating from excess balance in the Senior Prescription Drug Assistance Program. We've asked BHA to comment on how these funds will be used to support behavioral health services in fiscal 2025. In addition, statute only allows this balance to be used for behavioral health care services in fiscal 2018. And so DLS is recommending adding a provision to the BRFA of 2024 in order to authorize the use of this balance for behavioral health care services. And then we've also recommended language that would make the $5 million that's already budgeted in BHA contingent on the BRFA including that provision. The second is a contingent reduction. So the fiscal 2025 allowance includes language that would reduce $3 million in general funds, contingent on legislation that would authorize the transfer of excess special fund balances from 3 different boards. We've asked BHA to discuss the planned use of these balances in BHA and when it anticipates the funds would be added to the budget. Next, I'll provide an update on assisted outpatient treatment programs. So legislation currently being considered would establish assisted outpatient treatment programs at local behavioral health organizations, and the fiscal 25 allowance includes $3 million for BHA contingent on that legislation passing. However, the legislation as introduced does not establish a funding mechanism. It doesn't establish county grants for the program, even though the contingent language includes county grants. And so DLS recommends amending the contingent language to remove that reference to grant programs. In addition, DLS has a couple of concerns about establishing this program because of the amount of effort that this legislation would require of local jurisdictions and the amount of money that's currently allocated. And so we've asked MDH to describe the specific uses of the $3 million in startup costs that are included in the fiscal 25 budget, indicating which jurisdictions will receive funding and in what amounts. And we've also asked MDH to discuss the other fund sources that might be available to supplement this funding. The next section of the analysis is an update on behavioral health provider reimbursements. The 25 allowance includes $2.8 billion for provider reimbursements for behavioral health care services. There's also $107 million in the budget for provider rate increases, which includes 3% discretionary increase for fiscal 25, as well as the annualization of that 8% increase that began January 1st of 2024. DLS conducts annual forecasts to assess the adequacy of the funding that's included in Medicaid and BHA each year. And on page 18, Exhibit 9 shows the amount budgeted in fiscal 23, 24, and 25 in 2 different behavioral health programs and the amount that DLS projects is needed. And so from this chart, you can see that DLS is estimating there will be a surplus in fiscal 25 for behavioral health services for the uninsured population and a smaller surpluses in fiscal 24 and 25 for the behavioral health services for the Medicaid eligible population. Despite predicting some surpluses in these programs, DLS is not including a recommendation to reduce funding because we believe these surpluses could be used to reduce shortfalls in Medicaid. On page 20, we have personnel data. So as I mentioned earlier, BHA is adding 69.5 new positions in the fiscal 25 allowance. This includes 20 positions that were created by contractual conversion in fiscal 2024, and we've asked MDH to discuss the planned uses of these new positions. In terms of vacancies, as of December 31st, 2023, vacancy data showed that BHA had 39 vacancies, but this appears to include 19 new positions that align with the contractual conversions that I just mentioned. Of the remaining 20 vacancies, 9 have been vacant for more than 1 year. We've asked BHA to comment on efforts to fill and reclassify long-term vacancies. The first issue I'll discuss is the BHA investments that I've mentioned a couple times. The fiscal 24 appropriation included $107.5 million for new investments in the behavioral healthcare system. And this includes $35 million for crisis response services. MDH reverted this funding in fiscal 23 because it was in the process of having these services be licensed so that they could be eligible for reimbursement under Medicaid, and the process took longer than anticipated. As of February 15th of this year, MDH reported that the licensure and Medicaid regulations for the crisis services were published by the Division of State Documents on February 9th, 2020, and were under public comment. We've asked MDH to provide a date when the providers will be able to start billing for this service. Exhibit 10 shows the planned uses of these behavioral health care investments, as well as the actual uses planned in fiscal 2024. There have been a few changes just due to changing priorities. But this chart shows what of those have changed. Notably, there's several services that were anticipated to be ongoing year over year, and instead, the department has decided to make them one time in fiscal 2024. On page 23, I've noted that fiscal 2025 allowance includes $89.2 million for ongoing services and programs. And some of what's been funded in fiscal 2024 is listed in this bulleted list and includes the expansion of assisted living slots, additional permanent supportive housing slots, and additional residential rehabilitation program beds. We've asked MDH to explain the cost of these investments so far and how they align with the projected costs that are presented in a report that they submitted July 2023, laying out the planned investments. Exhibit 11 on page 24 breaks out the funding in the fiscal 25 allowance for behavioral health services, for behavioral health investments. And from this pie chart, you can see that more than half of this funding is dedicated to crisis response and stabilization, and that includes the $35 million for reimbursable services. Because that process to make these services eligible under Medicaid has taken longer than anticipated, the Department of Health has been issuing one-time grants to providers that are already offering this service. We've asked MDH to comment on what portion of the $35 million budgeted in fiscal 24 has been allocated to grants and how much will be used for provider reimbursement toward the end of fiscal 2024. On page 25 and 26, we've also noted that the Department of Health has been staffing the Commission on Behavioral Healthcare Treatment and Access, which was established by legislation in the 2023 session and was created to examine the public behavioral health care system and make recommendations to strengthen the system. The commission conducted a needs assessment of various elements of the public behavioral health care system and released its first annual report at the end of 2023. Part of the commission's work is to assess behavioral health administration spending in relation to the behavioral health continuum of care, which is shown on page 26 in Exhibit 12, and runs from prevention, promotion, education, all the way through early intervention, urgent services, and treatment and recovery services. So this exhibit maps out where the 2025 investments fall on this continuum. And we've asked MDH to comment on activities that the commission is taking a part of that'll examine the adequacy of funding and cost effectiveness of investing in parts of the continuum earlier on the spectrum. On page 27, we begin an update on the ASO, the Administrative Services Organization. There were challenges in recent years with the ASO due to inaccuracy of reimbursing providers and not reimbursing providers in a timely way, which caused the Department of Health to have to estimate payments to providers in order for them to continue providing their services. This resulted in overpayment of some providers, and so MDH has been in the process over the last couple of years of recouping those overpayments and forgiving providers in some instances. As of February 15th, 2024, the outstanding balance to be recouped totaled $52.7 million, and MDH anticipates completing this process by June 30th, 2024. Language in the fiscal 2024 budget bill restricted funding pending a report on the recoupment of overpayments and forgiveness of overpayments. But as of February 15th, MDH had not yet submitted this report. And so DLS is recommending adopting language restricting funds pending submission of the report. MDH has also been searching for a new ASO, and they released an RFP on January 10th, 2023. On February 14th, 2024, the Board of Public Works authorized a new ASO contract with Carillon Behavioral Health, Inc., which began Friday, March 1st, and ends December 31st, 2029. That concludes my presentation for BHA. So in closing, we have DLS has recommended restricting funding for 2 reports. We have also recommended adopting 5 pieces of annual language that would authorize the transfer of funding between different behavioral health programs, as well as a program under Medicaid to make up for shortfalls in Medicaid. There's also a recommendation around amending legislation, the contingent language related to the assisted outpatient treatment program. And there's an additional BRFA recommendation that's being considered by the full committee.
And thank you, Ms. Camaro. Seeing no questions from my colleagues, at this time, I'd like to bring up Madam Secretary and her team.
Good afternoon, Chairman McCray, members of the committee, Laura Harris-Scott, Secretary of Health for the record. I'm gonna turn it over to Deputy Secretary Alyssa Lord, who's fairly new, but before I do that, just wanted to, thank Naomi as always for the detailed analysis. Like I said, in the last time, we always learn something through this process, even forcing us to do a deeper look at what we're doing. But did want to set the stage for what you're going to hear and as it relates to the budget. Behavioral health, as you've heard me testify before, has been a priority for me in this role since I took office last year. And one of the things that we did, just so we could be more intentional in providing behavioral health services, given the crisis that we're in now, is we pulled claims for 22 and 23 and then looked at those claims by provider type, by service type, by geography. And we did that for mental health and substance use disorder. And then we mapped it out across the continuum, which Naomi presented to you on, I don't remember what page, but it's in the budget analysis. We then looked at our grants and we did the same thing with our grants and we mapped it out by county. We didn't get more granular than that, but we mapped it out by county. And what we then said, okay, if there's no X in that column, then that means we're not providing the service. So we know where we're providing services and who we're providing services for. We also know where we're not providing services and who we're not providing services for. As you can imagine, children and adolescents are doing worse than we're doing than in adults. And that's partly a limitation of providers and some visibility related to what's happening in the school. But we also know communities of color are not accessing services. So as we move forward in this behavioral health continuum of care, we are being more intentionally in what we fund based on the white space that I've described. So having said that, I'm pleased to turn it over to Deputy Secretary Alyssa Lord. She came to us in very late August, September, so she's been on board just for months, but has already demonstrated her expertise in this field and certainly her understanding or evolving understanding of the Maryland market. So I'll turn it over to Deputy Secretary Lord. Thank you.
Thank you, Secretary Herrera-Scott. Good afternoon, Chair McCray and committee members. I want to thank you all for your time today to talk about the Maryland Department of Health's proposed budget for behavioral health and the alignment of funding to support the Moore-Miller administration priorities to achieve an equitable, world-class, high-quality health system that provides whole person care and treats everyone with respect, compassion, and delivers on improved health outcomes and experience. My name is Alyssa Lord for the record, and I have the privilege of serving as the Deputy Secretary for Behavioral Health. I'm here today to share our commitment to Marylanders to put solutions in place to strengthen our behavioral health continuum of care. A slide in your deck represents a framework for a patient-centered model of integrated mental health and substance use care, also known as the continuum of care. As the Secretary mentioned, this model evolved after an extensive review of claims and utilization data to understand the current landscape of service utilization, as well as identify opportunities for investments in services. For context, and as represented in the DLS analysis, in 2023, more than 318,000 Marylanders accessed mental health and substance use services. The state actively engages our local partners and stakeholders to assess and evaluate core programmatic needs within the continuum to sustain and or bring to fruition. As such, this has led to the recognition that we need to, at a minimum, further define a strategy for children, adolescents, and families, inclusive of revamping our current 1915I initiative and reestablishing adolescent inpatient SUD services, provide an additional focus on veterans, older adults, problem gambling, and suicide prevention, and expand housing and transitional community-based care from facility efforts such as residential rehabilitation and assisted living programs. The governor's fiscal year 25 allowance adds 69.5 new positions for BHA. This includes staff to strengthen BHA's efforts to ensure quality of behavioral health services through licensing and compliance activities, crisis services, housing, and shoring up BHA's fiscal and procurement infrastructure. We are also working to fill long-term vacancies, including the Director of Finance and Fiscal Services. We are interviewing 4 candidates in the next couple of weeks. We actually had the first interview today. On February 14th, 2024, BPW authorized a new ASO contract with Carillon Behavioral Health. As you heard from DLS, the contract begins on March 1st and ends December 31st, 2029. Carillon is slated to go live January 1st, 2025, allowing for a 10-month period for design, development, and implementation. And we actually had our first kickoff call on the first day of the contract last Friday. The recoupment forgiveness process related to the current ASO is still ongoing with a June 30th timeline for balance reconciliation. I would like to take a moment to recognize the governor's commitment to and investment in behavioral health. The governor's fiscal year allowance provides a 3% cost of living increase for behavioral health providers to ensure that we have the workforce needed throughout the continuum of care. I would also like to acknowledge the $89.2 million in the fiscal year 25 budget to continue behavioral health investments in Maryland that were started with the $107.5 million in the fiscal year 2024 budget. There are several initiatives funded in fiscal year 2024 that will continue to be funded in fiscal year 2025. This includes statewide expansion of the collaborative care model, mobile crisis and crisis stabilization center reimbursement. Our regulations are in public comment, and we are expecting to be able to finalize them this spring. And community placements of individuals discharging from the MDH healthcare system, such as crisis respite beds, tertiary beds, and permanent supportive housing. I want to thank you for allowing me to speak today on the importance of the behavioral health continuum of care and how we can move forward together. With that, I will turn to provide brief highlights of our written responses to the DLS questions. In the interest of time, I will focus on a few of our responses. Regarding vacancies, BHA is actively working to address and remediate vacancies through increased and improved coordination and a continuous review process. In response to billing for mobile crisis and crisis stabilization centers, we anticipate providers to begin billing for these services in late fiscal year 2024, with an increase in billing in fiscal year 2025. We are also pleased to share that $13.5 million in grants were recently awarded to support mobile crisis and crisis stabilization centers, and I believe the press release is going out imminently. Regarding the $107.5 million in behavioral health investments as represented in the 2023 JCR, the funds currently support initiatives that are underway, including crisis services, collaborative care, tertiary care, and hospital discharge initiatives. Lastly, we thank DLS for the recommendation for the budget lock expansion to provide the flexibility needed to ensure the department can target budgeted resources where they are needed and to address any potential deficits. Happy to answer any questions.
Thank you, Madam Secretary and Madam Deputy Secretary. And I guess a couple questions. One of them was in reference to the emergency petitions. We had a written testimony from the Disability Rights of Maryland, and just wanted to get your thoughts in reference to what they have brought up about emergency petitions, the use of emergency petitions in reference to our young scholars and the uptick in it, if you wanted to comment on it.
So I unfortunately haven't seen the letter and have the details. If we can get back to you with a written response.
Perfect. And the second one was in reference to, I believe, the $3 million in spending. Didn't hear about, I think the question was from DLS also, like geographically, where would it be spent at? I know you had talked about a couple of things that it would be spent on, but like what the whole state of Maryland, a couple areas that you all are focusing on or things of that nature?
So are you referring to AOT?
Yes, ma'am.
Okay, so the way we're doing it is The $3 million, much of the money will be used for planning grants and for setting up the program. And we know that there was a lot of concern by the local jurisdictions having to set up an AOT program. But we know if it's not standardized and it was optional, then we'd have 24 different flavors that would impact people differently. So we were trying to build off the bill that was introduced last year. So the idea is for those jurisdictions that would want to do it, we would work with them with the planning grants to set them up. And then for the other jurisdictions that are not interested, we'll do it for them, similar to kind of what the federal government did with the exchange. So that's the plan for the dollars. Planning grants to shore up what's needed at the local behavioral health authority, connection to the crisis teams, and then getting people started on treatment.
Okay. Madam Secretary, seeing no questions from my colleagues, I just want to say congratulations and glad to have you there, Madam Deputy Secretary. Thank you for your leadership and what you're doing. We are going to move towards the public testimony part of it from that standpoint, so please stay tuned.
Thank you.
And colleagues, at this time, I would like to call up, we're going to call them up in twos. We'll ask them to give 2 minutes of oral testimony, and it looked like the first is Madam Director Lori Doyle and Mr. Dan Martin.
Thank you, Mr. Chairman. Lori Doyle here on behalf of the Community Behavioral Health Association of Maryland, just to raise two issues with your subcommittee. The first is to thank Governor Moore for that 3% increase. It's sorely needed. We had big staffing challenges prior to the pandemic. Of course, it's only gotten worse. So that will go a long way to help us retain our viability. The other is around the ASO. And we hope to persuade this committee, both the committees, budget committees, to monitor the transition to the new ASO and the new ASO's functionality. Our current ASO, Optum Maryland, was a disaster from day one. I think you probably remember the scathing audit report from the Department of Legislative Auditors. And our providers are still reeling from the dysfunction from 2020 when they started. The analysts talked about the estimated payments, the advances that were made. We're still paying them back. So now we have a new ASO coming in, and we're worried about Optum's functionality, which has been subpar all this time, going even worse as it ends, its contract in December. We're already seeing delays in payment, inaccurate payments, and our providers are very financially brittle. We cannot sustain any problems with payment, any delays in payment. So we ask that as the new vendor comes in, we will certainly not be sorry to see Optum leave, and we have high hopes for the new vendor. But we also note that the bidding on this vendor contract was again awarded to the low bid. And we've seen that now for the 5 times that this contract has been bid out. And we've noted a reduction in the functionality of the ASO over the years. So we ask that you please keep an eye on this as it transfers to the new ASO, but also as that ASO steps up and starts to take over the contract January 1 next year. Thank you.
Mr. Chair, members of the committee, Dan Martin with the Mental Health Association of Maryland, here to support full funding for the Behavioral Health Administration and really just give an endorsement of the work that the BHA is doing. BHA is doing the work and making the investments necessary to really build out and modernize Maryland's mental health and substance use continuum of care. We're really excited for the continued development of a comprehensive statewide crisis response system. This is something that we've been working towards for 20 plus years now. And thanks to the hard work of the folks at BHA, we're closer to that goal than ever before. We're also very encouraged about the plans moving forward on several other really important priorities for the public, expanding access to the collaborative care model, which you heard mentioned before. This improves the quality of behavioral health care delivered in primary care and pediatric care settings, establishing a network of certified community behavioral health clinics, which are specially designed to provide a comprehensive range of behavioral health treatments, care coordination, and connection to other systems and supports. A revamping of the 1959 program to ensure access to home and community-based high-fidelity wraparound services for children and youth with intensive behavioral health needs and their families, and a transition to more value-based purchasing, which will allow the flexibility, coordination, and creativity necessary to meet the varied and unique needs of individuals with complex behavioral health disorders. And so these are things that were all prioritized last session by the Maryland Behavioral Health Coalition and passed overwhelmingly by the General Assembly. There are strategies to improve behavioral health outcomes, save money, and keep people out of crisis. And we're thrilled that BHA is taking seriously the charge and doing the work necessary to make sure these policies, programs, and services are implemented equitably and successfully. And so again, we're very encouraged by these efforts. We're very encouraged by the partnership and strong working relationship between BHA and Medicaid and moving these projects forward. We're encouraged about the efforts underway to rebuild an infrastructure at BHA and the Department of Health to support this work. So thanks for allowing me to speak. Thanks to BHA for all their hard work, and please support full funding for the administration.
And thank you both for your leadership. Colleagues, at this time, we'll ask Mr. Dan Rabbit and Ms. Rosemary Quinn to come to the podium.
Mike, can we just ask if Ms. Quinn and Mr. Crook could come up together? They're just kind of a team.
Okay, is it okay to bring up Ms. Ann Seacott, and then next we'll bring up Ms. Quinn and Mr. Crook together?
Appreciate that.
Yes, ma'am.
Good afternoon, Chair, members of the committee. My name is Dan Rabbit. I'm the Policy Director at Behavioral Health System Baltimore. BHSB is an independent nonprofit that serves as the local behavioral health authority in Baltimore City. As an LBHA, we are the local partner of BHA on the ground. We're engaged in monitoring and overseeing the full range of services in the public behavioral health system in Baltimore City, and are also engaged in some regional initiatives. We're in full support of the BHA budget, and I'm here mostly just to say thanks to the administration for these investments. In particular, the increase in rates can address our serious acute behavioral health workforce shortage. So we're very appreciative of that. And the new investments that are continuing to be made in crisis services and the 988 helpline can solve a lot of the challenges that we're seeing in our communities. Crisis services and 988 can help reduce unnecessary trips to the emergency department, reduce hospital boarding, and improve the mental health services provided to our youth. And so we think these are really important investments, and just ask for a full funding of the administration's budget. Thank you so much.
Mr. Chairman, members of the committee, I'm Ann Seacott, representing the Maryland chapter of the National Council on Alcoholism and Drug Dependence, expressing our full support for funding for the governor's proposed budget for the Behavioral Health Administration. A couple of thank yous. One, for the 3% rate increase that you've heard a couple of times now. Providers are, they're just very necessary. We are grateful, as was said earlier, that we're changing ASOs. That's going to be very meaningful. We are also very grateful for the department's recognition and I think very intentional steps to filling a big gap, and that is in adolescent substance use disorder treatment. We think that that's going to be a really important move. And as the department and the administration has talked about getting to a point of being able to rebalance some focus in different areas, we just want to recognize the really great need for funding for recovery supports of all kinds in the throughout the state and in harm reduction efforts, both the funding part and also some of the policies to really help do something about our, again, uptick in opioid overdose deaths. So with that, we want to say, please support the budget.
And thank you both for your leadership. Colleagues, at this time, we'll bring up Ms. Rosemary Quinn and Mr. Jeffrey Crook.
Hello, hi, I'm Rosemary Quinn, and good afternoon, and I thank you for the opportunity to testify today. I'm here representing Be More Clubhouse, where I'm both a volunteer and I'm currently serving as the president of our board of directors. Be More Clubhouse, you may know or may not know, is a nonprofit organization. We're located in Baltimore City, and we work with adults who are living with varying degrees of mental illness. And we refer to all of the adults that we work with as our members. And through the meaningful and active participation of our members in actually running the clubhouse, which is based on a work order day, These members have an opportunity to enhance their own sense of purpose, their self-worth, and their confidence so that they may go on and live meaningful lives in their communities of their choice. We operate on an accredited evidence-based model that makes use of a work order day to facilitate a sense of structure combined with peer-to-peer support by the members and also to improve their own lives. Through this integrative psychosocial recovery approach, our members are actively building long-term relationships with other members as well as our staff, which in turn has really encourages them and supports them as they obtain employment, education, and in housing in all of our communities. Our organization, Be More, is very much in support of the Behavioral Health Administration's budget for fiscal year 2025. We also very much endorse the direction of the state, which does include support for community-based behavioral health programming, such as a Be More Clubhouse. There was a time when the Clubhouse did receive funding from BHA, and we look forward to working with them again going forward. There's also our hope that we may work with BHA and elected officials across the state, because we'd like to create community, opportunities for individuals living with mental illness through the expansion of the Clubhouse model throughout our state. So thank you. And with that, I will defer here to Mr. Jeffrey Crook.
Good afternoon, Mr. Chairman and committee members, and I thank you for the opportunity to testify before you today. My name is Jeffrey Crook, and I've been a member of Be More Clubhouse since 2019, almost 5 years. In that time, I've gone from trauma associated with sexual assault by a stalker and schizophrenic episodes to various milestones of accomplishment that I'd like to share with you today. I'm pleased to tell you that I am now a board member of Behavioral Health Systems Baltimore. I'm gainfully employed, and I'm working to become a licensed peer support specialist. My license will allow me to pursue a career counseling and helping adults and young people who are challenged with mental health issues similar to my own. Furthermore, I'm an active member of the Career Development Unit and the Employment Subcommittee at Be More Clubhouse, which Ms. Rosemary Quinn spoke of earlier. Based on my personal experience, these two working groups at the Clubhouse enable Clubhouse members like me to go out and be active in their communities at large. Organizations like Be More Clubhouse greatly depend on funding from the state to help people like me lead rich, full lives. Thus, I would ask for your full support of this budget for BHA. Thank you very much.
And thank you both for your leadership. Very familiar with the work that's happening at Be More Clubhouse. Great example with the leadership under Director Jason Woody. And I also think that the secretary went to visit during the interim.
Yes, we all got to meet several months ago. The entire staff came, and it's been pretty wonderful. And we do appreciate all the support that you and other elected officials across the state have given us, and looking forward to working with you again in the future.
Same. So thank you for your leadership and colleague. We have one more public. Senator Hedelman, sorry about that.
I'm also very familiar, and Rosemary is a friend, and I know the wonderful work that Be More Clubhouse does. So thank you for being here.
I really appreciate that.
Appreciate it.
Thank you. I'll have a great day.
So you got all these fans out here. Colleagues, we have one more public testimony. If the representative from On Our Own of Maryland, Inc.
Thank you, members of the committee and the administration, for the opportunity to speak today. I'm Michelle Lifshin with On Our Own of Maryland. We represent an affiliated statewide network of more than 20 peer-operated wellness and recovery centers that are funded through BHA contracts. We support funding of the BHA budget, and we'd like to express our gratitude to the department and the administration for last year's and the upcoming 3% provider rate increases. These significantly boost our center's operations, help us retain hardworking staff, and expand services. Thank you. Last year, our network served 8,500 people living with serious mental health or substance use challenges. Many could meet eligibility criteria for the proposed statewide assisted outpatient treatment program with a $3 million price tag, which we question and continue to strongly oppose. Our centers overcome barriers to engagement by providing free, voluntary walk-in services with no diagnosis or insurance required. Trained peer staff assist individuals with meeting basic needs, health education, enrolling for disability and Medicaid benefits, connecting with treatment providers, and finding housing, education, and employment. As a provider recently told us, when someone has burned all of their other bridges, they are still welcome at On Our Own. Community-based, non-clinical, and peer-led recovery support programs like ours are a valuable and cost-effective component of the continuum of care. Across our network, the average cost per person served is less than $500 per year. Thank you for allowing us this time to highlight the importance and impact of non-clinical services funded through the BHA budget, which achieve great returns on investment. Thank you.
And thank you. Colleagues, seeing that we have no more public testimony, just wanted to say to our partners, just that we hear you very loud and clear. Madam Secretary, you got a lot of raves and reviews about this respective budget. I think that, Ms. Dole, as you stated about the ASO, we know some of the challenges that we had previously, but I also think that the Secretary has been in close communication, been very transparent, and we're also watching that respective transition also. Madam Deputy Secretary, I'll say once again, on behalf of all of the respective Health and Human Services Subcommittee, we look forward to continued partnership. You're a very vital, critical, important piece to this puzzle. And just if there's ever anything that we can do, please do not hesitate to reach out. Thank you again all the time, Madam Secretary, for your leadership. Ms. Camaro, seeing that this is the last budget hearing that we have, if you could just send to all of the analysts the deep dive and review of all of the committees that they've done. We're so thankful from that piece of it. And just also being able to work with you this year as our respective coordinator for our subcommittee has been you've been the glue to kind of help keep us together. So just thank you for your leadership. Colleagues, is there any comments? Did I hit a home run? All right.